Good day. My name is Nicole Natividad, and in this video, I am going to talk about APGAR Score, how it's done and what's normal. Observe proper hand washing and sterile glove use. First, identify the patient. So we'll have an identification on the crib, but they also have the name band. So I'm gonna unwrap the baby and check the name band. So as you can see, this is baby CL that I'm looking at. So the APGAR score is a rapid systematic assessment of the newborn immediately after birth, and each letter is for an individual assessment. APGAR. A for appearance, P for pulse, G for grimace, A for activity, and R for respiration. Its 5 components classify the newborn's neurologic recovery from the stress of birth and immediate adaptation to extrauterine life. And scoring is based on a 3-point scale. That's 0, 1, or 2 for each component, then totaled to give an overall score. Total scores range from 0 to 10. So the newborn is rated 1 minute after birth and again at 5 minutes on the following criteria. First, we have A for appearance. So skin color is inspected for cyanosis and pallor. So now you have to uncover. So 85% of normal newborns have blue extremities with the rest of the body pink at 1 minute after birth. And that is called acrocyanosis and rates a score of 1. While an infant that is blue or pale all over scores 0, and a completely pink newborn scores a 2. Next, P for pulse. So now we also have to assess fetal heart rate, which is right between the nipple line. So here's the nipple on my infant, and I'm going to place this right between, and I'm going to listen for a full 60 seconds. So a heart rate less than 100 beats per minute indicates the need for immediate resuscitation. And if the pulse rate is absent, score is 0, while pulse less than 100 beats per minute scores 1, and pulse greater than 100 beats per minute scores a 2. So after that, I'll check the grimace or reflex irritability, and it can be evaluated by stroking the soles of an infant's feet. Okay, so no response to stimulation score is 0, while a grimace from aggressive stimulation scores 1, and if there's active motion, for example, if the baby is coughing, sneezing, or there's vigorous cry, the score is 2. Next, A for activity or muscle tone. So the muscle tone is determined by evaluating the degree of flexion and resistance to straightening of the extremities. A normal newborn's elbows and hips are flexed, with the knees positioned up toward the abdomen. So if the baby is limp or if there is no muscle tone, the score is 0. 1 point if the arms and legs are flexed but not moving, and 2 points if there is active motion. So last but not least, R for respiration. So respiratory effort is a very important APGAR assessment. So take note that infants are not chest breathers. They breathe through their abdominal muscles. So you have to look below the ribcage at the abdominal muscles and watch for the rise and fall to let you know that they are breathing. So complete absence of respirations is called apnea and scores 0. Gasping or weak respiratory effort scores 1. And a vigorous cry indicates good respiration, scoring a 2. So APGAR score is completed at 1 and 5 minutes after birth. A 1 minute APGAR score of 0 to 4 means severe depression, requiring immediate resuscitation. 5 to 7 means some nervous system depression, and 8 to 10 is normal. Whereas a 5-minute APGAR score of 0 to 7 means the newborn is at high risk for subsequent CNS and other organ system dysfunction, and 8 to 10 is normal. Take note that scoring may continue at 5-minute intervals until the score is greater than 7. If the 5-minute APGAR score is 8 or more, proceed to a more complete examination. Thank you very much for watching this video.